My name is Kayla Dowler, and these are special tests of the elbow, forearm, and hand. The first test we're going to perform is the valgus stress test, and we're going to be pressing on the medial side of the arm and the arm about 110 degrees of flexion, and we're going to be looking at that radial crucial ligament, and we'll be looking for any laxity, which would indicate a positive test, so we will compare both sides. The next test is the valgus stress test, and we're going to place our arm on the medial side, and we're going to be doing the same thing, and we're going to be looking for laxity, so we're going to compare both sides, and that would indicate a UCL tear or an MCL tear, but that would look at the ulnar collateral ligament, which would be indicated by laxity, so you compared both sides. We're now looking at the lateral pivot stress test, and we're going to place the patient's arm over their head. We're going to put axial load, and then we're going to twist the arm and looking for any apprehension or fighting me on wanting to do this test, which would indicate a various amount of ligament issues in the elbow. We're now moving to the chair sign test, and I instructed her to basically stand up with using only her arms, and then we're looking for any apprehension, which would be indicating a positive test, which would be indicating a radial head ligament injury. The next test is Cozen's test. This tests for wrist extensor injury.
And then I'm going to pronate you. I'm going to be sitting.
A positive test would be indicated by a reproduction of symptoms.
Try to extend your wrist and your arm against my resistance.
Wait, so push like that?
Yep.
This test is the elbow flexion test.
30 seconds.
Serve. Okay.
Positive test is indicated by reproduction of symptoms indicating neuropathology.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
17! That's a good number.
19, 22, 23, 24, 25,
I'm not hearing a Mississippi.
27, 28,
Yeah.
30.
So you leave the arm there for 30 seconds and see if it produces any symptoms indicating a positive test. The next test is the lunotriquetral shear test. So we're going to start by placing our hands in the lunotriquetral joint, and we're going to kind of shift those bones back and forth. A positive test would be indicated by pain or laxity, and it would be indicating any instability in the wrist.
Okay.
Okay.
Oh, did you feel
I
that?
felt that.
Yeah. R.I.P. my wrist.
Okay. Is that one hurt?
Okay.
You go like this.
Ooh, this kind of hurts my shoulders.
So try to bring your elbows up.
I'm just kidding.
This is Fallon's test, and it is indicated by paresthesia, which is indicating looking for carpal tunnel syndrome.
Fingers wrapping around your thumb.
Mm-hmm.
And then try to move your arm up like this.
Like
Against me.
Okay.
This is the Finkelstein test. A positive test is indicated by a reproduction of symptoms indicating de Quervain's syndrome. This is the thumb UCL laxity test, and we're going to start by putting a valgus pressure or stress through the UCL part of the thumb, testing for laxity, so we would compare both sides, and it would indicate a UCL tear.
I do not have a patient with me today, so I am going to be performing the test how I would show them how to do it and then performing it myself. I'm performing the trigger finger test, and I would have the patient with whatever injured finger it was. We're going to use the middle finger today. Have them flex it and then kind of extend it kind of quickly to see if it has a painful click lock during the extension. And the positive test would indicate that indicated by that painful click or lock, and would be indicating a flexor tendinosynovitis.